Good day, and welcome to What's Happening MoCo, an authentic, unscripted podcast from your Montgomery County government. Now, here's your host, Derek Kenny.
Good day, and welcome to What's Happening MoCo. Today's episode, we talk about health equity with a focus on underserved communities. Joining us in this discussion is Councilmember Laurie Anne Sayles, an at-large member of the Montgomery County Council. Sayles is the first Jamaican American and Black woman to serve in a countywide office. Sayles serves on the Health and Human Services Committee and Economic Development Committees. Fantastic. How are you today?
I'm doing excellent. Thank you.
All right. Well, thank you for joining us. Health and wellness has been a passion of this podcast for quite some time, as it has been, I think, for the entire county government this calendar year. I'm not sure if it's the fiscal year, but this calendar year, we've really been focused on health and wellness. Why do you, well, first of all, before we start, how has your summer been?
I had a great summer.
All right.
I'm grateful that we have time to recalibrate and, reset and refocus our agenda for the upcoming year. I think, with the change in administration, it's an important time for us to really understand where we're going, reflect on the budget, and then move forward with urgency on ensuring we're meeting the needs of the community. So excited
Wonderful.
to get back into the swing of things.
And as I understand it, when it comes to the needs of the community, there are certain underserved communities that are facing health and wellness challenges. Um, why is that a passion of yours? And what are some of the challenges that these underserved communities are facing?
Well, I'm a Black woman. And so, that already puts me at, a disadvantage. I make 40
Mm.
cents on the dollar to, my white counterparts. I am, you know, predisposed to cardiovascular disease.
Wow.
And, I can rattle off a number of disparities,
Mm.
and, African Americans top those lists. It's the list that we don't necessarily want to be at the top of, unfortunately.
Wow.
And, Montgomery County is home to some of the four of the most diverse cities in the country. And so, as the county's lead for eliminating disparities in public health, it's important for me to not only, you know, be aware of the disparities, but also be intentional about the solutions that we need
Mm.
to, employ to address them in a strategic way. And now more than ever before, with, cuts to Medicaid and
Mm.
cuts to food,
Yeah.
nutritional benefits,
Mm.
our workforce impacts, that's going to have cascading effects on our communities of color. And so it puts us in a very unique position to utilize, shrinking resources to
Mm.
address growing problems and do it in a unique way that's going to reach a diverse cross section of our community.
Yeah, and we're one of the most diverse communities in the country, not just
Yes.
Maryland. But speaking of uniqueness, you are actually in a unique position as a council member to address health disparities or any issues when it comes to health.
Yeah.
Tell us a little bit about your background in health and how that helps you to position you better to understand some of what's going on when it comes to what minorities are facing in the county.
Definitely. I'm the daughter of Jamaican immigrants, and my
Mhm.
father was in the military. My mother was a social worker with Montgomery County for over 30 years. And so she had a deep understanding of some of the challenges that our most vulnerable communities faced. And once my father finished his 20-year career in the Army, he
Wow.
went back to school and became a nurse. And so he worked at the bedside of some of our sickest patients
Mm.
across Adventist Hospital, Walter Reed. And so, just being exposed to that public service, my first job, I spent probably 8 years as a pharmacy tech
Oh,
working at
wow.
CVS.
Okay.
And then Kaiser Permanente. I did
Okay.
my internship at Kaiser before graduating with a degree in public health from College Park.
All right.
And then
Cool.
I worked at the nation's top research institutions from NIH and left my career at the FDA to do this full time.
Okay.
And so now I get to have all of that experience working on the front lines to now sitting as, the Board of Health as a council member
Hmm.
to, work with our public health officer. And that was during the pandemic when I was on the
Wow.
city council and now as an at-large member,
Mhm.
being able to work with all of these partners, all six of our hospital leaders and meeting with them on a regular basis, understanding the demands on our emergency system, knowing that we have, a growing number of seniors that are aging in our
Mhm.
community, and then lots of low income residents as well who have limited access to healthcare resources. And so being able to pivot and adapt to the changing needs has been a challenging but rewarding. We're fortunate to live in a county that has the resources to create a mobile health clinic.
Mhm.
So, regardless of whether you live in East County or in the rural parts of our county, we want to make sure that you are not at a disadvantage because of your zip code. We want to bring those healthcare resources to you. So, I've been so grateful that we've been able to put a mobile clinic in, the ag reserve. We have it in, East County.
Oh gosh.
And
Okay.
so, from dental services, preventative services,
Hmm.
regular checkups, we're trying to meet our residents where they're at when they can't get to the doctor's office or, they have to use an emergency room to
Mhm.
get, healthcare services. And then we have so many nonprofits that have stood up and transitioned from the pandemic to serve our residents and also do it in a culturally competent way so no one feels discomfort
Mhm.
or experiences bias when they seek help. We want to ensure that through our minority partnerships that they have access to culturally competent care providers.
All right.
Mm.
And speaking of, seems like a very thoughtful approach to healthcare for
Yes.
residents,
Yeah.
and very considerate of those residents that may not have a relationship with their primary care doctors. We even have primary care doctors, and as you mentioned, their only recourse. I mean, some resource sometimes going to the emergency room where they may
Mhm.
not get the focused care or the knowledgeable care they need to have.
Yeah.
So that's not the only thoughtful approach that you've taken or that the county's taken when it comes to healthcare for
Mhm.
underserved communities. You've issued a report
I
from the
did.
county council's very own Office of Legislative Oversight. Tell us a little bit about the Office of Legislative Oversight, because it may be the first time some people are hearing about that.
Yes.
And what is the report that you commissioned? And then, of course, lastly, what is it saying?
Definitely. So, the Office of Legislative Oversight allows council members to do a deeper dive, a deep analysis on a particular topic.
Mhm.
When I got elected, there was a Washington Post article about, the impacts of the Roe v. Wade decision being overturned and what that meant for women, and what that meant for vulnerable women, Black women in maternal
Mhm.
health, and how they would be most impacted by some of these decisions. We already know that, if they don't have the appropriate, pre and postpartum care, that, they can lose their life, their baby can lose
Oh
their life,
wow.
and other circumstances can impact, a child and mother making it past that critical time. And so I wanted to better understand what Montgomery County has done in the past to address Black maternal health. What were we doing here
Hmm.
in comparison to other jurisdictions, and what was at stake, what the risk factors were,
Certainly.
and any services that we could do. And I found out that we actually had a birthing center here in Montgomery County.
A birthing center?
We had a
Okay.
birthing center, and we found that, creating a program where doulas and, other healthcare providers,
Okay, we have to
midwives.
let's back up. So some of the terminology may not
Yes.
be something that can be easily understood by the average person.
Yes,
What's a
yes.
birthing center? What's a doula? What does this mean for non-traditional parents to be?
Yeah, so a birthing center was a place where, pregnant women could go to receive maternal health care services. They could
Mhm,
learn more about what it takes to take care of your body and your
mhm,
baby after you give birth. It talked to them about the labor and delivery experience. And then it actually gives you a doula, like a coach that's going to help you
oh
bring
wow!
your baby into this world.
All right.
And these doulas and midwives are trained to um, provide culturally competent care.
Mhm,
They help with making sure your nutrition is, where it's supposed to be, your weight, and any other testing that may need to be done. And that happens, if you are planning to become a mother while you are going through your first, second, and third trimester. And then once you
mhm,
go home, they are still, that source of support. They encourage breastfeeding. And so those
mhm,
healthcare professionals were, standard in our birthing center.
mhm.
But
Right.
not many health insurance providers cover those expenses.
Okay.
And so, if you are a minority and you are giving birth, you may be
Mhm.
experiencing pain during the labor and delivery process,
Wow.
and they may not believe you.
Mhm,
You may not get the emergency care,
mhm,
or, you may go through a C section when you could have gone through the normal childbirth process if
mhm.
you just had that patient healthcare provider to coach you through that process.
Yeah.
So there's a lot of benefits that we saw that the data showed was beneficial to women of color, but that went away with the loss of the birthing center. And
Mhm,
so, even our public health officer is, creating an advisory board to look at, some of the challenges that are faced
mhm.
in, this particular area of Black maternal health, and looking at resources, services that we can provide to
Right.
either recreate a
Mhm,
birthing center here, see what the possibilities are, what the barriers are to
mhm.
bringing such a center back, and then just ensuring that more Black mothers are able to bring their babies to term.
That's wonderful. And I guess healthcare begins with the birth and with the healthy mothers. And so you were talking about healthcare. That's probably the best starting point that the county can focus on when you're talking about the future of children having a great start, a healthy start is where it can start.
Well, it actually begins before,
Hmm.
you have to make sure that you're eating healthy, you're
Right.
taking your prenatal
Oh wow.
vitamins,
Yeah.
that you have an environment to bring a baby into. Do you
Hmm.
have the space for, the crib? And
Hmm.
are you aware of all of the, materials that you are supposed to have for your baby, how your baby's supposed to lay in the crib, and,
Hmm.
what the most appropriate,
Yeah.
um, you know, way to bring the baby home and get
Hmm.
acclimated to this new responsibility. And so, we have lots of programs here in the county that we
Wow.
pay for. That are free to moms to ensure
That's
that
one
they
of my
can.
favorite words. County resources
Free.
free.
Yes,
So
yes.
there's no barrier to getting that help.
No,
All
no.
right.
From the SMILE program to our other programs that, help with ensuring that, our mothers are maintaining a healthy weight.
Hmm.
They are going to their checkups, trying to ensure that babies are at a healthy weight before they
Right.
leave the hospital. All of that has to be
Yeah.
determined before they even come into this world. And so having that support system and that information helps mothers,
So
and
many,
baby.
so much great information out there for new parents who may not know
Definitely.
some of the things that they may want to do that they shouldn't do, like don't lay in the bed with your baby, because you might
Yes.
end up smashing them,
Yes,
especially if dad's
suffocating.
a big
Yeah.
dad, like, myself. So, yeah, you wanna love and hug on that baby, but don't fall asleep. Okay.
Yeah, and
Um,
all of these,
yeah.
OLO reports,
Mhm,
you can go on our website,
mhm.
type in the search bar any number of topics
Oh,
that
wow.
we have explored
Mm.
and learn information about, the racial impact, the environmental impact, and
Oh, wow.
the financial cost of some of these
Mhm.
decisions and how they can be implemented. They also include recommendations for improving outcomes.
Yeah.
So, it's a really good resource that we have that residents can access.
Right. It's a very thoughtful process. And many times residents question, how did you make this decision? And it
Yes.
starts with a thoughtful process with research, recommendations, a very scholarly approach to assessing the situation and making recommendations. What did this
Definitely.
report say about the disturbing things when it comes to the homicide rate and the suicide rate among African American men?
Well, this is Suicide Prevention Month.
Yeah.
And so, mental health was the number one factor that was on the minds of residents during our community survey
Hmm.
that we sent out to residents. We do it every other year, and it has been the number one issue since the pandemic. And
Yeah.
so, our council president, Kate Stewart, she
Hmm.
hosted an event about, mental health. We've also recognized mental health awareness month.
Hmm.
I believe that's in May
Yeah.
to raise awareness about the resources that are available, you know, um, from everyone. It's not just our kids, and
Hmm.
we even put resources into the budget to ensure that our correction officers had access to mental health resources
Right. Yeah.
in our correctional facilities.
Hmm.
We've seen our officers, commit suicide right here in Montgomery County.
Oh,
So
no.
we don't want anyone to, not have accesses to these important resources. And,
Mhm.
I'm so disappointed that, that our young Black boys are, at the top of this list
Yeah.
for suicide rates
Mhm.
and homicide, and gun violence is at the center of this discussion. The country has been in turmoil because of gun violence,
Yeah.
and we're not thinking about who's most impacted. And so I'm glad that we're having this timely discussion
Mhm.
because, at the end of the day, it's in the numbers. Who's being impacted and what are we doing about this?
Right.
Guns are too available
Mhm.
to our kids. And if they don't have access to the necessary resources for mentoring or things to do out of school time, positive experiences,
Right.
or, ways to resolve conflict
Mhm.
in a meaningful way, they are going to quickly resort to, making rash decisions that have long term effects. And so, we are seeing that, the CDC said that, 40% of the deaths among Black men aged 15 to 34 have primarily been by firearms.
Oh, no.
We're also seeing that firearms were involved in over 90% of the homicides among Black males aged 15 to 44.
Oh, gosh.
So just to think that our young men
Mhm.
don't know how to resolve conflict or think that they are in situations where
Mhm.
that is the only answer is a scary reality that I don't think we are, doing enough about.
Right.
I don't know who's talking to our young men
Mhm.
or they don't always have someone to go to. And do they feel comfortable being vulnerable? Do we give them the space to feel
Mm,
vulnerable? What messaging are we putting out for our young men to seek help and
right.
feel comfortable asking for help? And so, it's very important for us nowadays to ask our kids how they're
Mm,
doing.
yeah.
We quickly,
Yeah.
want
Yeah.
to make sure that they are getting good grades, they're showing up,
Hmm.
but are they really showing up and are we showing up for them?
Right.
We're asking a lot of our educators, and they are on the front lines of checking in with our students.
Hmm.
But when you have a classroom of 30 plus students, you don't have a paraeducator,
Hmm.
you don't have, the support to not only meet these benchmarks that are required in our blueprint,
Hmm.
but also ensure that your kids are mentally, emotionally, and
Right.
physically prepared to learn.
Hmm.
It creates just a incredible amount of
Right.
concerning factors for our students and then our families. So,
Yeah. And it's just important to note that it's okay to not be okay. And
yes,
a lot of times,
yes.
kids don't, with all that their parents are probably dealing with or their families are dealing with. You may not know that it's okay as a young kid, to not be okay,
Mhm.
and that your feelings do matter, and that it's okay to share that with your parents or with a concerned adult and seek help. And even for
Yes.
families that, in many cases, mental health is a bad word when you start thinking, you immediately go to crazy. My baby ain't crazy. It's not crazy. Human beings have needs, and there's need to care. There's certain um, things in place to help us with our mental well-being,
Yes.
that can help to dissuade us from bad outcomes.
Mhm.
And you're talking about that now. The report shows that there's a need, and you've shown that council is looking to provide some type of services to help to address that need. Um, what other barriers are there to healthcare that exist now among other served communities? Not all of them. You just give a
Yes.
couple. I know
Just
there's
a just
quite a few
a
barriers, but
just a
yeah,
few. Financial. It's
hmm,
expensive.
yeah,
If you don't have insurance, it's hard to find a healthcare provider.
hmm,
And so, through our Black Physicians Health Network, we are able to
hmm,
provide culturally competent access to free mental health services
hmm,
for our residents. And, we stood that program up during the pandemic and it's continued because we saw the demand.
yeah,
We saw that there was still a need.
yeah, yeah.
We
Kudos to them. They were at the Friendship Picnic and
Oh,
they partied
good.
with, I
I'm
think,
so glad.
Ready Health. And when I talked to Ready Health, they had given away 60 free flu vaccinations,
Very
which of course
good.
will not only help the health and well-being, but for families where sickness or a 1 week flu could be the
Mhm.
difference between paying the rent that month. That's such an important resource that the county is helping to put out there. So kudos to that program that you mentioned just now, the Black Physician Healthcare
Black
Network. Yeah,
Physicians Healthcare Network.
wonderful,
Yes.
wonderful. Okay.
And we also have our wellness centers that are at some of our schools. We're trying to expand those wellness hubs so that, our students and their families have access to these preventative and regular services, whether it's, classes where they
Mhm.
can access mentors or they can even just talk with someone
Right.
about any physicals that they need to
Mhm.
participate in extracurricular activities. We're trying to meet our residents where they are. And, we work with our nonprofits to make sure that we also have culturally competent care. We
Right.
have a nursing shortage that's
Oh
impacting
wow.
how many people can
Mhm.
even be served. That's why we have some of the longest emergency room wait times in the nation. So, in addition to the financial costs, in
Mhm.
addition to the cultural limitations
Mhm.
on who can give you culturally competent care, do we have the staff? Can you access this care? And then are you dealing with the stigma associated
Oh
with
wow.
accessing this care? And, that And that's where the problem lies,
Mhm.
making it normalizing getting help. We
Mhm.
normalize getting, our twice a year visits to the dentist and
Mhm.
knowing that when,
Yeah.
we have a cavity, we go to the dentist,
Mhm.
knowing that when something doesn't feel right in our body, we see our primary care provider.
Right.
But what are we encouraging and how are we educating our young people
Mhm.
about how to seek help and when?
Right.
What's appropriate and what does that look like and
Yeah.
why you should feel comfortable in doing so and why it's part of our overall holistic health.
Oh wow, that's daunting. We applaud you for taking on such an intimidating cause such as this. You've seen the
Yes.
data, so you know there's a
Yes.
serious need, and you've seen the
Yes.
budgets over the years, so you know
Yes.
there's limited resources. But you're taking on this with a very conscientious and thoughtful approach, with an eye on impact in the community. What do you see on the horizon in terms of initiatives? I know it's early on, but what types of things that might be in the works that could be encouraging or something to rally around for the community in Montgomery County, Maryland?
I think we're going to have to take a more holistic approach to addressing these challenges.
Mhm.
Education is number one, ensuring that, our community understands the resources that are available to them, ensuring that they are available in a variety of mediums, languages, and ensuring that our residents see themselves in the messaging that we create, the
Uh-huh.
marketing for them to access these resources.
Mhm.
And we are supporting our students through the pipeline to pursue these career opportunities. you know um, we also have to, invest in these awareness campaigns. We have to
Mhm.
advocate for policy changes. We know that, this year we have funded our budget, but next year,
Mhm.
we don't know what's going to happen. We had the highest job loss from the federal impacts here in the county. So we know that there are a lot of people here that don't have health insurance. COBRA is
Mhm.
expensive.
Mhm.
The Affordable Care Act, they are potentially going to be cutting the subsidies that made it affordable to access care in that marketplace. October 1st is right around the corner. If this budget isn't funded, there's going to be a lot of people who are going to be hit with a lot of challenges that we're going to have to absorb. And so, we're bracing, we're working with our Health and Human Services Department. We're in close communication with our federal partners to understand how to communicate, what we can continue to, you know, encourage our residents to access. But it's really going to come down to keeping those lines of communication open
Mhm.
and ensuring that we are raising awareness about the services that are available to our residents.
Speaking of services that are available and resources available in the county,
Yes.
we're going to change hats. I'm going to take my
Okay.
host hat off. I'm going to give it to the very capable and eloquent, and of course, better on the lens than I am, Councilmember Sayles, and she will be talking to a county representative about the
Yes.
resources available when it comes to health, wellness, and well-being in the county. So up
Awesome.
next, look forward to something better.
Welcome back to What's Happening MoCo. I am Council Member at Large Laurie Anne Sayles, and I am so excited to share this platform with our Chief of Behavioral Health and Crisis Services, Chief Monica Martin. Thank you so much for joining us.
Thank you for having me here. Such a pleasure.
Of course. Why don't you share a bit about yourself? You've been in this role. Has it been a year yet?
It will be in another 10 days. So almost.
Okay.
Yeah.
So we are
Yeah.
almost at your 1 year anniversary, and you have been with us for quite some time in different roles, made it through the pandemic, and now leading our behavioral health and crisis services. So tell us a bit about your journey and what this year has been like for you.
Thank you. I will. But I can't do that without first thanking you, Councilmember Sayles, for your service to the whole county, and especially on the Health and Human Services Committee, and as a clinical licensed social worker to your mother for her 30 years of
Oh,
service as a social worker here in Montgomery County.
thank you.
I'll never forget that in your first term as a council member, you very proactively reached out to come to visit one of our linkages learning sites and
Yeah.
learned about some of our integrated primary and behavioral health care for our youngest students at MCPS. So thank you for that. So as I just shared, I'm a licensed clinical social worker, so I'm a clinician by training,
Okay.
and I've had the privilege and honor of working for Montgomery County's Department of Health and Human Services for 18 years at this point.
Wow.
Before then, I was doing a lot of work focused on youth and families. That's how I came into this county work. So I was a clinician that specialized in working with adolescents and their families, working in the private nonprofit sector and a behavioral health organization that served the Baltimore and DC, Greater Washington metropolitan area. So I'd done that for 8 years. Focusing on prevention and early intervention in the beginning, partnering with the county's Department of Health and Human Services to expand some of those school-based initiatives and programs at that time when our linkages learning initiative was expanding in the Up County region in particular. But prior to that, I had done work as a hospital social worker. I had done work as a social worker serving migrant populations in rural Virginia. I had done school-based work as well, hence the circle back around to the passion for integrating mental health care into our schools. And then when I came to Montgomery County and HHS, that's exactly what I stepped into, kind of furthering those school-based partnerships within our Children, Youth, and Family Services division
Yeah.
to be school-based, school-linked, all kinds of different avenues to try to, again, reach more youth and families in that wonderfully accessible location of the schoolhouse and the
Yeah.
community that surrounds it. So a year ago, I came into this role and kind of back into my clinical roots in terms of overseeing some of our services that serve the most vulnerable of our residents in terms of those that experience the greatest disparities
Mhm.
and the greatest barriers to accessing behavioral health care as part of our local public safety net. So this is where I am now, and I'm so privileged and honored to be here with you today.
Thank you. Thank you for sharing that with us, Miss Martin. And so this is Suicide Prevention Month,
Sure is.
and we know that our young Black men are most vulnerable
Yeah.
to suicide, and homicide is the number one, disparity that they are experiencing.
Mhm.
You know, what are we doing to encourage and instill self love in this population? And how would you define self love in practical everyday life? And how are we modeling and, encouraging our students to do the same?
Yeah, thank you for speaking so eloquently to all the barriers that so many populations face in um, really accessing all the resources and supports they need to be healthy, period. It all contributes to escalating states of mental health distress if you don't have access to healthy resources, period, as you're growing up
Mhm.
and disenfranchised in doing so. But in terms of the term self love, it can sound abstract or cliche, but it's really about how we treat ourselves, especially
Mhm.
when no one's watching. That's the key thing.
Mm.
That's the qualifier
Yes.
that I always put out there,
Yes.
especially when no one else is watching. So it's really the ongoing practice of valuing, respecting, and caring for yourself physically,
Mhm.
emotionally, mentally, in all realms through your actions, through your boundaries. It's a very important one aspect of
Boundaries.
self love, and through
Yes.
self talk.
Mm.
So it is everything from getting enough rest and not glorifying burnout to
Yes.
giving yourself permission to feel emotions without judgment, to saying no to things that drain you, even when you're expected to say yes.
Mm.
So it's those kinds of things that we need to do for ourselves to keep ourselves healthy and at our best.
No, that's so important. As women,
Mm,
I think in our parents' generation, it was glorified to be superwoman. And I'm so glad that our generation has learned
Yeah.
about the burnout culture, and we are now trying to model healthier ways to, you know, exercise self love and hopefully instill that in the next generation. And so you mentioned some small practices that our, young people and community can do. Um, how does this contribute to, overall better mental health and overall wellness?
Yeah, it really makes a huge, huge difference. If I can elaborate a little bit more on, if
Yes.
people don't know about this concept, many people have heard
Hmm.
about it, but don't know whether or not they're practicing it in their day to day lives.
Yeah.
I always say, and you'll hear anyone who's familiar with this concept say, if I treated myself like someone I deeply cared about, what would I do differently today? For me, when I feel like I'm struggling with self love, I think about my dear grandmother, my
Oh.
96-year-old grandmother in Puerto Rico, who is
Oh.
still with us and probably will outlive
Mm.
all of us, but who is so endeared to me. And I think if she were saying this to me right now, if she were feeling this right now, if she were doing
Mm.
this right now, what would I be saying back to her? And so it's really important to try to have that perspective with yourself, to
Yeah.
try to adopt that self compassion,
Mm.
because when you replace that harsh self talk that many of us have grown up with, and when you replace that with kinder, more understanding words such as "I'm doing the best I can right now," and that's enough, right?
Yeah.
I'm enough. When
Yes.
you allow yourself to make mistakes and to love yourself through those mistakes,
Hmm.
I love the term that I adopted at some point, that I'm a recovering perfectionist. Right? It's a lifelong journey,
Yes.
and I've built a small community of recovering perfectionists along with
Good.
me in the workplace, and we have
Yes.
conversations around this. Um, that all allows us to, again, take a step back from the immediate situation because we have to learn that narrative, that self talk. It allows us to regulate our emotions, which reduces
Mm.
stress hormones, which helps
Yeah.
with our overall health. It allows us to prioritize ourselves. And again, not be in relationships that are codependent or toxic, right? Part of that, what I
Yes.
mentioned earlier, was the boundaries piece,
Hmm.
learning to how to say no, understanding that no is a complete sentence. And it's okay to be said, and not just, once. It doesn't mean that you're throwing a tantrum, especially as a woman, if you're setting a
Yes.
boundary or
Yeah.
otherwise. There's so many things that youth as well can do for themselves in situations where they are seeing themselves reflected through the eyes of, for example, social media. It is so
Hmm.
important
Yeah.
that adults model for youth unplugging, intentional unplugging from social media use, from the electronics,
Oh, yeah.
to ensure that there's the capacity, again, to instill conversations, intentional conversations, whenever possible, around that positive self talk that is so important to have. So, no, the benefits are immense. It reduces
Hmm.
anxiety and depression,
Hmm.
absolutely. It helps to kind of lift the mental load of the worries that lead to anxiety and depression. I
Yes.
could go on. The benefits
Yes.
are quite a few.
Yes, I'm glad that we have, the county's Respect Fest happening where
Yeah.
our young people are really driving the communication, the around healthy relationships and boundaries, and yes, knowing that no is okay and being comfortable with it. And so I'm
Absolutely.
glad you mentioned that boundaries. And so being chief of this department, what are some common signs that someone should reach out for professional support
Yeah.
instead of trying to push through and, try to navigate this challenging time on their own?
Yeah, I think first and foremost, it's important to always remember that it's always okay to reach out. It is
Yeah,
never a mistake to reach out.
good,
If
good.
it turns out you're reaching out and you're speaking to a mental health professional or a call taker on our 988 line or your
Hmm.
primary care physician and you're sharing, I'm having these thoughts, These are my new behaviors. I'm finding myself avoiding certain things. Whatever's happening for you,
Yeah.
I'm not enjoying what I used to enjoy, whatever that is.
Mhm.
Anyone in the helping profession is going to be, first of all, very, very affirming that you have done that, because that's a source of strength. Reaching out for help,
Yes.
it's not a sign of weakness.
Mhm.
And if it turns out you don't need therapy right away, they're going to make that assessment and they're going
Yeah.
to support you through that. And that's okay. Having said that, it is normal for all of us to have our ups and downs. Absolutely. And there are certain times when it really is important for us, if we notice these things in ourselves, or
Mhm.
for our loved ones, if we're noticing in our
Yes.
loved ones, for us to prompt them to reach out for support with. Certainly persistent feelings of sadness or hopelessness, right? So not
Mhm.
temporal, not for a short period of time, but for weeks or months without relief. That is definitely a sign. As I mentioned earlier, the loss of interest in activities that you once
Mhm.
enjoyed, having not just nerves or stress, but overwhelming anxiety or panic. So constant worry, racing thoughts, certainly
Mhm.
panic attacks, anxiety that interferes with your daily life or
Yeah.
with your decision making, right?
Mm.
Paralysis due to the stress that you're feeling, difficulty regulating emotions. So if you're someone who typically doesn't express anger and suddenly you're having intense anger, irritability, or it's a slowly escalating thing that you notice, or the converse, emotional numbness. You're
Mm.
not expressing the emotions you typically would have expressed. If you're having mood swings that affect your relationships or your work, if you have changes in sleep or your appetite,
Yeah.
those are symptoms that often accompany depression or anxiety. And certainly if you find yourself withdrawing and isolating, if you're avoiding the social interactions you used to enjoy, if you're feeling disconnected from others, even if you're still interacting with them, but you're feeling like
Mhm.
people aren't hearing me, people aren't seeing me, they aren't understanding me, or I don't want them to right now
Yeah.
because it's too scary to think
Mhm.
about what they might see or what I might see reflected in them
Mm.
if they shine a mirror on me, right? So those are all signs that you
Yeah.
should reach out. Certainly thoughts of self-harm or suicide, that is
Yes,
an emergency.
definitely.
Do that right away.
Mhm.
But it's absolutely critical that we know, just like with any aspect of our overall health and wellness,
Mhm.
prevention and early intervention is key.
Yeah.
It absolutely can turn the curve on experiencing more symptoms later, more anxiety, more depression, more debilitating situations. So reach out when in doubt.
Thank you. Always a good time to reach out and have someone you can trust when you're feeling down. And so I know that, you mentioned it's always a good time to reach out. And what can friends and family members do?
Yeah.
What are some of the warning signs that they should recognize to support a loved one and encourage them to take that next step to get help?
Yeah. So obviously, having observed anything that I already, shared,
Yes.
but again, there's different signs for different people. Trouble concentrating or completing tasks or maintaining productivity. That's important. If you notice that in a colleague at work, for
Mm.
example, if someone expresses sentiments such as they're feeling stuck or unable to move forward in life, if you see your loved ones taking on some unhealthy coping behaviors, so the increased use of alcohol or drugs or other risky behaviors, or again, distractions or avoidance
Mhm.
behaviors, such as binge watching, overeating, things like that to avoid emotions, if that's a shift in what someone is doing typically. If you're seeing that someone's trauma or grief seems to be unresolved after a loss, after abuse, after a major life change, if they're sharing that they're having flashbacks, nightmares,
Mm.
or they're avoiding reminders of some of their past experiences they've been
Mhm.
through, all of these things are things to watch out for. And what's really important is that you should never be afraid to directly speak to
Yeah.
someone that you
Mhm.
think, even if it's not true, even if it turns out they're just fine and they're
Yeah.
just having a day. Okay. It's never wrong to check in,
Yes.
right? Better be safe than sorry.
Mhm.
Supporting someone struggling with their mental health can really, it can be challenging, but also deeply meaningful. So the way to approach it is to start with I sentences, right? We talk about a
Okay.
lot. So I've noticed you seem really down lately, and I'm concerned, right?
Yeah.
It's about your observations, it's about your worries. You want to make sure to avoid judgment. You're not trying to fix or problem solve. You want to listen with empathy, be an ear.
Mm.
You want to encourage professional help seeking. And I've often said, do you want me to go with you to your first appointment with a
Mm.
therapist? Um, Normalize the idea of therapy and help
Yeah.
seeking by comparing it to seeking help for physical health, right? Because mental health struggles they're brain-based issues.
Yes.
They're part of our biology and physiology. We are
Mhm.
all one being. It's very important. It's important to be patient and consistent with our loved
Yeah.
ones, especially those that are struggling with ongoing mental health
Mhm.
concerns. Healing is not linear, just like it isn't for a lot of other chronic conditions,
Yeah.
physical conditions. So, ensuring that you kind of stay the course with them,
Mhm.
respecting boundaries, but also checking in. There's so many ways. This is, in the digital age, uh, this is what's great. You don't have to show up at someone's door. You don't have to pick the phone and call. You can do a text. You can do a chat. Just little
Yeah.
check-ins can make all the difference. And offering very practical support,
Mhm.
running errands, watching kids, things that just relieve a burden for someone who's going through a mental health struggle.
Nice. Those are such helpful tips to recognize. And, just thinking about our kids and how much time they spend on social media and, being a parent
Mm,
and checking in and asking those questions. Who are you talking with? Who are you
yeah.
surrounding yourself with? And, understanding the vulnerabilities that, our um, young people could be exposed to on
Yep.
those online platforms,
Yeah.
chat rooms. And so
Yeah.
it's great that parents and loved ones can check
Yeah.
in.
And it's critical to get into that world, right? No teenager is going to be like,
Yes.
sure, here's what's happening. But if you get into that world with genuine interest, which comes out of love for our kids anyhow,
Yes. Yes.
and just have really, honest interest in
Mhm.
what's happening for them online in their online lives, you'll get bits, you'll get
Can
enough.
make a
Yep,
difference.
yep.
Yes.
And then monitor on the side. So if you have access to monitor directly and could do it, do it.
Yes, definitely. And so, for someone new to therapy, the
Hmm.
process of finding a provider can feel overwhelming.
Yeah.
Where can we direct our community, our young people? Where can they start?
Well, for our young people, you have many more resources in your school building now than we
That's
used to here in
true.
Montgomery County, even
Yeah.
just 5 years ago. We have big schools. We're a large community. We're a diverse community. So I say that with all respect and affirmation for those that might still feel alone
Yeah.
in their school or in their community. However, you have beyond your school counselor, you have, depending on if you're in primary or secondary school, you have parent community coordinators who
Hmm.
also are there for young people, school administrators. We have lots of programs in MCPS right now to support you with. You already mentioned the wellness centers earlier that are
Yeah.
available in many high schools in Montgomery County. We have the Bridge to Wellness initiative that is available
Mm.
in all of the remaining high schools in Montgomery County. The important thing is that you reach out to someone you trust, whoever that may be.
Okay.
And if that's not an adult, if you really do not think you can talk to an adult, confide in a trusted friend,
Yeah.
right? And that's
Hmm.
why it's really important that we have so many youth led peer initiatives,
Yes.
and that we have youth trained in mental health first aid and
Mm.
all kinds of strategies to support each other and connecting fellow peers to care and in connecting them to trusted adults to support them.
Yes, we're very fortunate in Montgomery County and at the state to have well funded and accessible resources. And so, thinking about those resources, how can patients ensure the therapist is a good fit, whether
Yeah,
that's culturally, emotionally, practically, insurance, location, language barriers?
that can be tough.
Yes.
That can be tough. You have to think about it as it's a say, we shop for primary care physicians sometimes, right?
Mhm.
If we're lucky and we have options, which
Yeah.
not all of us are, right?
Hmm.
Um, but I will say the first step is certainly if you do have insurance, whether it's public insurance or private insurance, that you look at the number on the back of that card that might look like a number
Yeah.
that you're looking at to get your flu shot or to get your well visit. You call that number. Mental health parity exists in this country legally, and you ask you ask for the resources for behavioral health and that kind of support. If you're not finding what you need there, many insurance companies now, of course, have online directories, just like they might
Yeah.
for dentists. Again, whether it's public or private insurance, and you can use filters to search by location. It's really
Yeah.
important that you don't have to take 3 buses or drive an hour to access someone that you can um, seek help with. They have languages, most of them as well.
Mhm.
In terms of culturally competent care, a lot of them
Yeah.
don't have race. Some of them have pictures.
Yes. Yes.
But I tell anyone who is seeking therapy, I say whether or not your insurance company or the provider that you first go to says that they
Mhm.
offer this, ask for a one-time free consultation.
Oh, okay.
Many clinicians will do this.
Nice.
Not all will. I'm not saying that all
Yes.
will,
Yes.
but ask for it, right? You are the
Mhm.
consumer. Ask for it. Many will do this, especially upon request. They'll spend 20
Mhm.
minutes or half an hour with you. You can kind of interview them, get to know them a little bit.
That's a
It's
good idea.
confidential, and it
Mm.
gives you a sense of who they are before setting up an appointment. Um,
Okay. Good. And I know that, telemedicine is also on the rise. So
Absolutely.
addressing barriers to accessing care is becoming more and more easier to seek out. So,
Yeah.
what do you suggest if someone tries therapy and doesn't connect with their first provider? How can they advocate for themselves and still continue to seek the care they need?
Yeah. The first thing I recommend is that you share your thoughts and feelings about this not being a good match directly with
Mhm.
the provider.
Okay.
You may be surprised, and the provider may respond in a way that helps you feel safer, more connected,
Yeah.
especially depending on how long you've invested in that particular, relationship or
Okay.
clinical relationship. Um, that can be a very challenging scenario
Yes.
to feel comfortable sharing that. So it may or may not be the right choice for everybody
Okay.
in that situation.
Mm.
But if you feel like you can do it, I recommend it because
Yeah.
you should be seeing a professional. And if they are a professional, not only might they be able to change how they're supporting you in a way that is a
Mm.
better fit,
Okay.
but if that is not the case, they may be your best friend in helping you find your next best fit as well.
Okay.
Now, again, if you don't feel like you can speak to this person in that way,
Yeah.
then clearly that's not a safe place for you to be receiving therapy
Yes.
anyhow.
Yes.
And so, again, depending on your insurance status, it's important to go through your insurance payer to try to find the best fit. But there are other options as well. And so I just want to make sure that folks know that, again, both public and private insurers do have now individuals that are called health coaches or care coordinators that you can reach out
Okay.
to and say, look, I did this, it didn't work. I don't have time to keep shopping for someone else. Please help me
Yes.
out. You get to talk
Okay.
to them typically, and they get a sense of what it is that you're looking for and what you want.
Mhm.
And they might be able to support with kind of casting the net on what other providers are in your network or can be seen through your insurance and help make that match with you and for you.
Good.
If you do not have insurance, because many people do not, or you
Yeah.
do, and the copay is too high and the deductibles are too high for you to afford
Mhm.
it, know that you have other options. I need to repeat that the 988 Suicide and Crisis Lifeline is an
Yeah.
emotional support lifeline. You don't have to be in a situation that you assess to be a crisis to
Yeah.
call and get support,
Yeah.
including support around how to access treatment. Um, Here in Montgomery County, we have a service in our Behavioral Health and Crisis Services division that's called Access to Behavioral Health. So
Okay.
this is for adults who have no insurance or who
Mhm.
have Medicaid um, or Medicare. And you can access that service by calling 240-777-1770.
All
And
right.
they can support you with information and referral services. They can provide a screening for you over the phone, virtually, or in person. And this is for mental health assessments and for treatment for mental health and substance abuse concerns. You can walk in person without an appointment at 27 Courthouse Square, Suite 101 right here in Rockville. And if you do have insurance, public insurance, bring your proof of insurance and or income information. It's also a service that's available to provide telephone consultation for not just our residents, but professionals or referring agencies.
Wow.
So if you're connected to someone, if you're, for example, at a clinic and you have a wait list and people reaching out
Mhm.
saying, where else can I connect? You can call Access to Behavioral Health Services to get
Okay.
consultation about how to direct people that are looking
Mm.
for care. We're also fortunate in the state of Maryland to have what's called a health coverage assistance team. This is a
Oh.
state resource that can help you get answers to your health insurance questions if you're experiencing barriers, whether you're uninsured or insured. They address health insurance problems and concerns. It's also a place where you can file a complaint about your health insurance if you need to or your concern, but they connect you to resources as well. So they can be reached at 410-468-2442 or via email at hcat.mia@maryland.gov.
All right. Well, thank you again, Miss Martin, for bringing your talents here to Montgomery County. Thank you for sharing your perspective on mental health and ways we can seek out resources right here in the
Sure.
community in a healthy way. And thank you to everyone who joined us for this incredible segment and discussion. And that's our show for What's Happening in MoCo. Thank you.
Thanks for listening to What's Happening MoCo. Please subscribe via your favorite podcasting platform and follow us on Facebook. This podcast is brought to you by County Cable Montgomery, your source for news and information from the Montgomery County government. Connect with us via cable, Facebook, Instagram, or YouTube by searching for County Cable MoCo.